Hello everyone, this is Dr. George Rapier, and I'd like to welcome everyone. I'm going to talk today about each and every one of us, where we are today, and where I see us going in the future, and then some preliminary thoughts on how we're going to get there. As you all know, it was 25 years ago that we started WellMed as a single primary care clinic with 3 doctors taking care of a few thousand patients. Today, we have over 105 WellMed clinics, almost 500 WellMed providers, over 600 contracted primary care doctors, and we're responsible for the care of over 180,000 Medicare Advantage health plan members, as well as many other patients. We're growing, we're a stable company, delivering quality health care at an affordable price. And we're also now part of a much larger organization, Optum Care, that is changing medical care across the country for the better. Now, 25 years ago, I would have been satisfied with where we are today. I would have been pleased with all the things we measure: the clinics, the providers, the quality, risk adjustment, revenue, and profit. But today, I'm just not satisfied, because in 25 years of running WellMed and in 35 years of medical practice, it seems that we've overlooked something very important. Something that's critical to our continued success and growth as a company and as individuals. Today, we operate much like most organizations. We have leadership that makes plans, makes decisions, and pushes them down the chain of command. We take ideas and turn them into projects and processes and procedures and ask you to carry them out, to comply. Over the years, we've made many changes and improvements. We've tried many new ideas and have attempted to involve you as much as we knew how to do. We've had programs like open book management, our structure of lead physicians and medical directors to help guide our decisions, and recently 4DX. All of these and other initiatives were attempts to get all of our people involved, helping run the company and to get your feedback. I've always felt that these types of initiatives were critical to get everyone involved and engaged and participating in our company. And I've always felt that the physician and staff involvement is critical to our past and our future success. I've also felt the personal development and the ability to grow and advance was critical as well. And over the years, we've made opportunities available to many of you for promotions, additional education, executive coaching, and mentoring. Well, today, our growth is causing us to strain at the seams. Our people and our systems and our culture are having trouble with the current rate of growth and development. Furthermore, in recent years, I feel we've drifted from our roots, and our culture has become focused on process. We have become a profit-driven company and not a purpose-driven company. This change in focus away from our provider roots has even penetrated to the clinic environment. Now, don't get me wrong. A company can't stay in business if it doesn't pay attention to the details and doesn't make a profit. But I more and more feel something is wrong and that we're missing something. When I look at where we are today, I see many things that concern me. We used to be very focused on patient service and patient satisfaction. But today, when I look at our survey scores, be those Press Ganey, which is the company we hired to do patient surveys, or Tonic, which was a pilot that we did real-time surveys in the clinic on an iPad, or the CMS, HOS, and CAP surveys that reflect our star ratings, I'm very disappointed. Let's talk about Press Ganey results first, because with Press Ganey, we can compare ourselves to all the other Press Ganey clients, including thousands and thousands of doctors around the United States. So on the question of how would you rate your provider, our patients rated us at the 35th percentile, which means that 65% of the providers that were surveyed had a higher rating than us. When you look at the question, when you needed care right away, did you get the appointment as soon as you thought you needed it? Our percentile rating was 46, so 54% of the doctors in the country scored better than us. On the question, did your provider explain things in a way that was easy to understand, we rated at 19th percentile, meaning 81% of the providers scored better than us. On the question, the clerks and reception at your last provider visit treated you with respect, we weighed in at a 34th percentile. So 65% of the offices scored better than we did. And critically, on the question, would you recommend your provider to a friend, we scored at the 24th percentile. So over 75% of the other doctors in the country scored better than us. The best score we got was on the 52nd percentile, was the question on ability to get through to your doctor on the phone. Well, I don't know about you, but to me, this is all extremely disappointing. Now let's talk about our star ratings, because every year CMS does surveys of a subset of our Medicare Advantage patients and then ranks us on some type of questions I just went through on the Press-Ganey survey. In Greater Texas, on the question about getting needed care, we scored 2 stars. On the question about getting appointments quickly, we scored 2 stars. On the question about getting care coordination, we scored 2 stars. Again, I'm really disappointed. 2 out of 5 stars, sort of a D grade. Now I know that we've been broadcasting that for 2014 we actually achieved 4-star rating, and that's true, we did. But the most disappointing thing is what I just outlined. On the customer service portions, we scored 2 stars or a D. Very disappointing. So next, let's look at patient access in the clinics. If we take out the doctor times that providers are out for medical director responsibility or administrative time or meetings, our providers on average are seeing about 10 patients a day. I know that we ask a lot in the way of quality and risk adjustment and focus on care, but even at that, 10 patients a day is an extremely low number, and it shows up in our access to patients. We recently conducted an access survey using secret shoppers over the phone, and we have many clinics where the time it takes to get an appointment is unacceptably long. Furthermore, when I look at the employee surveys of our staff and our provider surveys, generally we see satisfaction, but there are too many areas of frustration and discontent. When I hear what providers and staff have to say, the common theme is too much paperwork, too much focus on box checking, too little focus on caring for the patient. And these are all certainly valid complaints, but execution on quality and risk adjustment is not an option. We just have to get it done. Let me talk a little bit about meetings. Meetings are necessary for gathering information, for communication, for clarity. Meetings should not be a substitute for personal responsibility and for making decisions. In my opinion, we have drifted into complacency, into lack of personal decision-making, into procrastination. Yesterday, I was having a conversation with someone in leadership. One of the people that reports to him has responsibility for a project that was languishing. I insisted that he had to take control. He was very reticent about this. He did not want to have a frank and honest conversation with the person who was not getting the job done. He was afraid of hurting their feelings. Now, I'm not out to hurt anybody's feelings, but being honest in a straightforward way should not be threatening. We must be honest in a caring way, but honest nonetheless. We must also each accept responsibility for the things we're tasked with and be able to admit when we're wrong or when we need help and be willing to get help in what we do and how we do it. Now, don't get me wrong. We do a lot of things right. We have a lot of good people, great people. But this is what I think is wrong. Today, we have many people who are concerned about preserving their reputation, who put only their best foot forward and therefore hide their inadequacies from others and from themselves. I understand this. No one wants to admit their deficiencies. No one wants to be chastised or put down or written up. But what would happen? What would happen if we were all comfortable with our weaknesses, and the culture at our company was committed to seeing mistakes as an opportunity to get better. You know, I'm not naive enough to not understand that some people don't want to improve. They will never admit they're wrong and will never fit into this type of honest culture. Our present culture has a lot of meetings because people are afraid of making a wrong decision. A lot of lost time and wasted energy covering up things that we're not comfortable with. We can continue to operate this way, the way we do today. We can continue to grow and be profitable, no doubt about it. We can continue to have a culture where people are more comfortable hiding in the shadows, hiding their weaknesses, where we have interminable meetings to make the smallest decisions, or we can do something different. We can start down the road to develop an organization that expects imperfection, but where we all support each other in improving ourselves and making us all better. A better me plus a better you equals a better us. Now, I'm not asking anyone to run out and make some catastrophically bad decisions or do something really stupid. Of course not. But I assure you, bad decisions have been made in the past few years, and we didn't learn from them. We didn't evaluate what went wrong so we could avoid repeating those mistakes. But our culture has to develop where it's okay to make a mistake, but not okay to hide it or avoid it, or worst of all, blame it on somebody else. This past September, a small group of senior leaders met with me for one day in California. The purpose of this meeting was to discuss our current culture and begin the planning of how to begin moving to an everyone culture, where everyone commits to honesty, truthfulness, personal responsibility, and the desire to improve. Here's what we discussed. First, we examined our strengths at WellMed. These included having a noble mission, great dedication and passion to our mission, being a provider-led organization, being innovative and agile, having strong metrics to support the organization, having engaged, hardworking teams, and recognition for our delivery model from a number of organizations, most recently the article in the New Yorker by Dr. Gawande. We then looked at things that hold us back, things we're not that great at. These include lack of clarity in roles and responsibilities, lack of holding people accountable, unclear messaging throughout the organization, too much decision by committee that takes too long and is often not even agreed to, too much focus on metrics and not enough on patients, a lack of experience in our dealings with contracted physicians, too much inbreeding and not enough new blood in the organization. Also, medical leadership that's not leading, not enough medical leadership with the right amount of training, mentoring, and clout. Furthermore, using email to solve problems and resolve conflict. And critically, failure to learn from our mistakes. We then discussed and agreed on 3 key business objectives that we have to focus on. First, senior leadership must improve the planning, prioritization, and resource allocation, requiring accountability at all levels of the company. Now, what I mean by this is too often we have people going in too many directions because senior leadership hasn't adequately planned and prioritized and allocated resources. We have to quit this. We have to get it right and get everybody on the same page. Secondly, physician leadership must be improved, knowing better what they need to do, including their management abilities, being better mentored, being more accountable, claiming authority and exercising it. All too often, I've seen medical leadership give up and say, somebody told me I couldn't do it. No, this is a medical-run organization. If medical leadership deems it needs to be done, it needs to get done. But medical leadership has to have the ability and management to be able to execute on this. Thirdly, we must improve our value proposition to the patient. including medical quality, customer service, more involvement of the patients, and better education to enable them to understand what we are truly providing, putting the patient first. Most importantly, we realize that making a list or starting a new program or rolling out a new management scheme is not going to take us where we need to go to continue to grow. Let me say that again. Most importantly, we realize that making a list or starting a new program or rolling out a new management plan is not going to get us where we need to go. We also realize that just saying we're going to get better, even if we really mean it, is not enough to move forward. Example I like is going on a diet. You want to lose weight. You know you need to lose weight. You know it will make you feel better and improve your health. And what happens? Well, you lose weight to start, and that goes on for some period of time, and then it slows, and then it all comes back, usually with more than you started with. We had the best of intentions. We really tried hard, but just willpower and hard work didn't get us there. Changing a culture and changing things for the better is a lot like that. We all want to expand on the things we do well and eliminate or minimize the things that hold us back, but so often the best of intentions don't produce results because something is holding us back. For something is holding us back. For years, I was obsessive compulsive about knowing everything, keeping my finger in everything the company was doing, trying to be way too involved. And that's where the phrase Dr. Rapier says came from. I was involved in and had something to say about everything. Obviously, we got way too big for me to keep doing that, but it was very hard to stop. Why? Why could I not stop? In a process some of us have used called immunity to change, I was able to identify some of the things that kept me trapped, that made me want to keep my finger in everything. I had assumptions about what would happen if I backed off. I had fears about what might happen if I changed the way I did things. In a structured, mentor-assisted process, I was able to test my assumptions and find that some of my assumptions were wrong, and some of the things I feared were unjustified. And by making small planned changes over time, just like someone who gets immunotherapy for an allergy, I was able to change what I was doing. Now, we're all like this. We all have things we assume, that we fear, that hold us back, that keep us from getting better. And because of that, keep WellMed from reaching its maximum potential, and that keep you from reaching your maximum potential. A key thing that our organization must develop is a way to provide everyone rapid and honest feedback. That is daily or weekly feedback on how you're doing, emphasizing the great things we've accomplished, but also being honest in a helpful way to identify the mistakes we make on a regular basis. That sounds pretty scary, doesn't it? Right now, we have an annual evaluation. So we wait all year for your supervisor to tell you how you're doing. Really? Wait a year? What if your spouse or significant other waited a year to give you some feedback? Well, maybe some do, but that's not a very good relationship. Good partners communicate all the time, both the good and the not so good, but done in a caring, helpful way. That way, a relationship stays healthy. Why shouldn't we do the same at work? Why should any of us go a week or a month or especially a whole year not knowing how we're doing? Waiting a year to do an improvement plan and waiting another year to hear if the changes you're making are showing improvement? That's crazy. I know the job we do is hard. I know that providing medical care to people that are sick and dying is difficult. I know that the number of things we all have to accomplish in a day to keep the business going is difficult. Some of the things we've asked you to do, we've asked without getting enough of your feedback or providing you enough support. For example, we rolled out an electronic medical record. Some providers adapted very quickly with no negative impact, but many others have struggled, impacting our access to patients. I understand, but providing poor access to patients is not the answer. So we have several options. Some providers have started using drag and dictate and have dramatically decreased their documentation time. Recognizing the time it takes to do documentation, we have started hiring scribes and are on track to provide 60 scribes to providers this year to work with the providers and dramatically decrease their documentation time. Certainly, some of these types of processes or changing the work conditions will often make things better, but doing only this, changing the process and ignoring culture and ignoring what is really limiting us as a company and individually will only go so far. I and senior management am committed to making sure that we provide what is needed to change our culture for the better. We are fully committed to becoming an organization where honesty and straightforwardness and personal responsibility are the key. Now let me assure you, this is not a flash in the pan. This is not the management theory of the day that will roll out and then roll away if you just ignore it. This is not going to be business as usual. We will start with groups of senior leadership. I'm not going to ask you to do anything that I'm not willing to do or have not already tried and found to be useful. This is a change that will take years. This is a change that we're in the very first steps of discussing. We're not ready to implement anything yet. When we are, we'll let you know. We will keep you informed of the things we try and the way things turn out before we ask you to participate. Wow, I've covered a whole lot of subjects today, so let me recap. We as an organization do much good. We have done much good. We have paved the way in pioneering a number of things in healthcare in the regions we serve. I'm very proud of what we've done, but I truly know that we can do much more. Today, we have a culture that lets people avoid personal responsibility, that tends to avoid difficult truths. This is not delivering to our patients or ourselves the type of organization that you and I want. We're going to change it. We're going to build a company culture where everyone supports everyone else, where we get and give honest feedback and caring and constructive feedback on a regular basis, where caring and compassion is paramount, but where we don't avoid the difficult truths or personal responsibility and personal growth and development. We're embarking on a journey that very few corporations have even tried. However, I know it's the right journey. I know in my heart that we can accomplish this through our efforts, through the ability to help ourselves and help each other, and thereby help our patients and create a better organization and a better world. We can all prosper and be satisfied and happy in ways we've not been before. I know that many corporations, including ours, have tried various initiatives in the past, and some of these have fizzled into nothingness and end up being disappointing. But I look at WellMed and where we are today and the accomplishments we have made, and I look at the expansion we're undertaking, and I'm proud of the things we've done. But I feel that the cultural changes I have outlined here are the most important thing that we will ever do together. Let me repeat. The cultural changes I've been talking about are the most important thing that we will ever do together. I know that the long-lasting impact on our culture and our organization will be amazing, and even amazing in our own lives. Today, I don't have a call to action. I don't ask you to do anything. As I stated earlier, we don't have a fully baked plan yet. When we do decide to start, we will start with senior management and work out the kinks before we move our ideas out to you. Today, I just ask you to keep an open mind. Keep an open mind and a desire to get better. So I really want to thank you all for your time and attention today. And I want to thank you in advance for being open to helping me change our culture and our lives and the lives of our patients for the better. Everyone have a great day, and may God bless.